Exercise throughout pregnancy is incredibly important for both you and your baby. Exercise in pregnancy has been found to reduce swelling in the limbs, feelings of nausea, fatigue, the length of labour, the likelihood of birth complications, pregnancy-induced hypertension, urinary incontinence, excessive weight gain, deep vein thrombosis, the likelihood of medical intervention in delivery, insomnia, diastasis recti, which is a separation of the stomach muscles, maternal psychological disorders like depression, muscle imbalances, leg cramps, constipation, varicose veins, hemorrhoids, back pain, gestational diabetes, as well as to improve maternal posture, well-being, self-esteem, energy levels, recovery time after birth, placental growth, fetal growth, and blood flow. Wow! Research has also shown that the rate of miscarriage is actually lower in runners and aerobic dancers than in non-exercisers. One study found that those who exercised during pregnancy had a 40% lower risk of miscarriage than those who were sedentary. And as if you needed any more persuasion, the birth weights of children born to women who regularly exercise are usually slightly less, by on average 300 to 350 grams, because the babies have lower levels of body fat, making delivery easier. So exercise in pregnancy is a must, and despite all the fear around it, the reality is that as long as you are healthy and haven't been told by your doctor or midwife that you shouldn't exercise, you can continue with the exercise that you were doing before pregnancy, albeit with additional care, caution, and consideration. Now, this does exclude contact sports and anything too dangerous where you may fall and hurt your stomach, as well as exercise at high altitudes, so greater than 2,500 meters, or underwater like scuba diving. High impact, high intensity plyometric exercise should also be avoided, so think insanity style workouts and jumping up and down off boxes. What this means is that if you are like me and do weight training, you can continue with your workouts in a similar manner to before you fell pregnant. Now, similar manner, what does that mean? Well, let me break it down into some very simple do's and don'ts for you to make it really clear. Pregnancy exercise do's. Do continue carefully with the exercises you were doing before pregnancy, as long as they aren't included on the list showing on my right now. Do perform core exercises throughout your pregnancy, but not from the position of lying on your back after the first trimester. Do perform pelvic floor exercises throughout your pregnancy. This will help with stress incontinence and with labour itself. Do exercise your back muscles. This will help to prevent lower back pain and postural imbalances like lordosis and kyphosis, which come with the pregnancy physique. Do exercise your chest muscles. Those boobs are going to grow, and to help prevent them from sagging too much, it's a good idea to strengthen the pectorals, the muscles that help to support them. Do exercise your quads and your calves. With your increasing weight, it's important to keep your legs strong so that they can continue to adequately support you. Plus, during labour, you're going to need a really strong pair of legs, particularly if you're like me and want to give birth as naturally as possible, which may involve the squatting position for long periods of time. Do get informed consent from your midwife and doctors at your 9-week booking appointment. This ensures that you are okay to exercise during your pregnancy. Do ensure that you are well hydrated throughout, so drink lots of water. Do take lots of rests so you don't get too tired. Ideally, you wouldn't raise your heart rate too high, so use the talk test to help you measure this. You want to continue being able to hold a conversation throughout your exercise. So if you're struggling to speak, slow down or stop and catch your breath. Do limit the duration of your exercise sessions to 45 minutes. Exercising for longer than this may affect the blood, the oxygen and nutrient supply to the fetus. Now, if you're a non-exerciser, it's still important to exercise during pregnancy. Keep the frequency and intensity of your sessions low to moderate and gradually increase the duration over a period of weeks. Do keep cool. This is especially important during your first trimester when the baby is at greater risk of hypothermia. So wear layers that you can easily remove and aim to keep your body temperature below 38 degrees Celsius. Do increase the length and duration of your rest periods. Do spend at least 10 minutes warming up and cooling down before and after your workouts. Do have a little snack before exercising to ensure that your muscles have enough glucose to use as energy. Do stop exercises that require you to lie flat on your back or on your stomach after the first trimester. So no prone back raises, no supine bench presses, no supine pec flies, etc. Do keep breathing throughout all exercises. Now, let's look at some pregnancy exercise don'ts. Don't exercise if you have any of the conditions showing on the right of the screen now. Don't exercise if you have one or more of the conditions showing on the right of the screen now without medical consent. Don't exercise to exhaustion. Don't perform any exercises that are high impact, high intensity or plyometric unless you're a seasoned athlete, and even then, check with your doctors and midwives before doing any such exercise. Don't exercise if you feel any of the things showing on the right of the screen now. So in short, keep exercising if you feel able to throughout your pregnancy to help your body stay fit, strong and active throughout the entire 9 months and ready for labour.